Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Srikar Karanam, who is a board-certified emergency medicine physician and the owner of Revamp Hormone Replacement and Weight Loss, a small business based out of the Appleton area that specializes in bioidentical hormone replacement therapies and both medical and natural weight loss solutions. After his residency was finished, Dr. Srikar embarked on a personal health transformation in which he lost over 40 pounds. Through that experience, he discovered that there is a significant amount of conflicting information that people oftentimes need to sift through when on a wellness journey, and he wanted to give people better support and information. So while continuing his work as an ER doctor, he established Revamp in February of 2024. Outside of work, Dr. Srikar considers himself a foodie and loves traveling, hiking, boating, snowmobiling, and camping with his wife and 2 dogs. We recommend listening to this 4-part series in order as the content covered in the episodes do build upon each other. With Dr. Srikar's expertise, we are excited to help you feel informed into the sometimes confusing worlds of hormones, PCOS, weight loss, and more. So let's jump into today's conversation. Hey everyone, welcome back, and welcome back to Dr. K.
Well, thank you.
We're excited to have you back. You have been a wealth of knowledge, and we're excited to continue talking about hormone replacement. But in this episode, we're talking about a little bit more specific instances that are pretty common in today's age. So we're going to be diving into PCOS and how hormone replacement therapy could potentially help that, as well as cancer. But let's start with PCOS, the bare basics. What is PCOS? What does PCOS even stand for? And what causes it?
Sure. So PCOS is polycystic ovarian syndrome. It's actually kind of old terminology because when people first started looking into this, first thing they noticed was people with PCOS have a lot of cysts on their ovaries. So that's how the name kind of tend to come out of. It is essentially a genetic disease. So it's not something you could really prevent. Of course, there are a lot of things we can do to optimize your health, but unfortunately, you kind of tend to be born with it. Usually pops up right around puberty. That's when your sex hormones are really active, and that's when you have the peak amount as well, and that's what kind of brings it up to the surface. So PCOS is essentially symptoms that kind of conglomerate together, and very recently, within the last 10 years, when we figured out what the underlying cause is. So the underlying cause is actually insulin resistance. So it really doesn't have anything too much to do with your sex hormones themselves. So what happens is you have insulin resistance, which means your pancreas creates a lot more insulin. And insulin itself is also a communicating hormone. So a lot of times we just think about diabetes, it kind of keeps your sugars in check, but it also interacts with every single organ in your body. So it essentially affects your thecal cells. Thecal cells are in your ovary, and that increases the amount of androgens. Androgens is another word for essentially testosterone, put in layman terms. And when that starts happening, that levels goes down, and now that kind of throws off all the other signaling that tells your brain to produce more estrogen progesterone, because now your brain thinks there's not enough of it or too much of it. So it kind of goes haywire as well. So it essentially gets into this really crazy circle that you have to force break it. And PCOS is also, it's really hard. It's also a scale of symptoms. And that's what makes it really, really challenging to diagnose. Most of the time, when you walk into a room and you see someone that's what I'll call like a linebacker look. They have like really broad shoulders, really big, heavy, more on the obesity side. They have facial hair. That's like a very clear-cut PCOS. But on the other side is you can have someone that doesn't have any physical characteristics, but then they get diagnosed because they're trying to get pregnant, and then they start having miscarriages.
So can someone develop, is PCOS something that's developed based off of potentially lifestyle choices? Because you can develop insulin resistance based off of your nutrition and lifestyle choices. We could have a whole
conversation on insulin resistance too. Ooh,
yes. Or is PCOS more like type 1 diabetes, where it's something that you are born with and then you have to figure out how to manage the symptoms?
So it's more, right now the trend thought is more around you're born with it, but then we can do a lot of things to pretty much minimize symptoms. It's not something you can completely cure, but it's something that once you're more active and really be aware of it, then you can pretty much completely resolve it. So once again, it's a really big scale. It really depends on where we are at.
So it's almost like type 1 and type 2 diabetes, kind of like a
to put like a layman terms,
right.
I think I've heard PCOS being referred to as type 3 diabetes.
That's pretty much once again, it's a common terminology to use. Yeah, it's not completely true, but once again, it all comes down to insulin resistance.
Right, insulin resistance.
Yeah, so I akin it to like more like type 2 diabetes, where if you start working on the core of it and then help manage the other parts of it, then we can kind of get you back to optimal health.
Do you feel like PCOS is on the rise? Is it more common nowadays, or is it just that it's maybe had like the same level of impact on humanity? It's just that people didn't really know what it was or how to manage it. Where do you feel like it lines on that scale?
So I think it's really multifactorial. I think people are more aware of it in general now, because that's not a word that my mother didn't know what it was. So like it's not a word that was even used back then. And also it's lifestyle has a big effect to it as well. Now we're eating more processed food. It's kind of coming up more to the surface. I mean, back in the day when you had subsistence farming, you really didn't have enough food to even cause insulin resistance. So now that we actually have more overnutrition, I think it's coming up more to the surface. So now we have to address it.
Well, and you're talking like insulin resistance too. A lot of the sugar and the things that are processed foods, that's, again, we could have a whole conversation on that too, I'm sure.
We could talk about hours about that.
So if PCOS is primarily caused by insulin resistance, where do you come into play?
Yeah, so my job is really to, first diagnose the dysfunction, and because without a clear diagnosis, we don't know what the treatment plan is going forward. And it also depends on the scale of the symptoms as well. So let's say for someone, we talk about a stereotypical PCOS patient, morbidly obese, facial hair, really significant insulin resistance, might have diabetes, heart problems. The first thing I do is first we got to get the lifestyle changes. They have to be on a very strict diet. Unfortunately, they can't use processed foods because they can't afford to do it anymore. And then we drop the weight pretty quickly, in a healthy manner. And we can talk a little bit more about that next episode with modalities that we can use to drop weight. And then a lot of times we can also do natural stuff like berberine, which is what metformin is derived from, to make your body more sensitive to insulin that you're producing. So it's pretty much becomes like a holistic approach to kind of get to where they need to be. And once we get them to the goal, then we kind of back off on some of the other things. Most of the time, my patients will continue either berberine or metformin because they have to have that support to keep them from going into insulin resistance again. Because the reality is, in today's life, it's really hard to eat nothing but holistic food. And then, honestly, it's not sustainable because you want to enjoy food. And it's unrealistic to say, you can't have that cake on your birthday anymore because you have PCOS. So that's unrealistic as well. So it's pretty much a holistic approach.
What's the timeline on that journey? So let's just say someone came to you because they were having a challenge with infertility, right? And they knew that they had PCOS, or you diagnosed them. What does that timeline kind of look like on helping them heal? Yeah,
a lot of times usually about 8 to 12 months will be the big journey. But I also like to, if you talk about fertility in particular, let's separate things a little bit first. So if you talk about just PCOS, you're just having symptoms or have effects of PCOS, usually takes about 9 months to 12 months to kind of get you back to your ideal body weight goal and get your lifestyle to a point where you really don't need me anymore. That's usually, because it's a long process to kind of get there. The second part is since it does affect fertility, I always recommend patients that they really need to have a close conversation with either a fertility specialist or their OB, get them involved in the process, because fertility itself can be from endometriosis, so you can have uterine fibroids, or you can have early menopause and you don't know about it at all, because some women unfortunately go into perimenopause period in their 20s and they don't know about it. So that's a whole nother conversation that we have for fertility itself.
That's really interesting. And I feel like, but just even to have a conversation like this and be like, oh, you can help is going to give a lot of women hope, because I mean, I can think of at least 3 people off the top of my head who have talked about that they have PCOS.
Yeah, a lot of times it's just educating. That's a big part of my job in my consults, is educating and laying out step by step. Hey, here's what we need to do to kind of get you back where you need to be. And I usually let my patients kind of pick and choose how they want to approach it. The goal is to get to the whole process, but we need to have a starting point. And the starting point is the biggest challenge of getting started. As you guys know from personal training, getting them into the gym is the hard part, getting the starting point. So once we start, then things tend to kind of just fall into place. You get motivated, you start noticing effects. Honestly, the biggest one is really the weight gain, because they put on weight really quickly and they're morbidly obese. So once we start actually dropping their weight, now adipose tissue makes estrogen and progesterone, and it decreases testosterone as well. So once that starts melting away, then your hormones start balancing a little bit more. And so that tends to really kind of, once again, falls into this big cycle. We had to break the cycle, but we had to start a new cycle that's beneficial.
Mm-hmm. And if for those of you who are listening are intrigued by what he just said about weight loss, we are going to be talking specifically about weight loss in the next episode, both medical and natural options for that. So stay tuned for that. But one more question for PCOS specifically is, are you supporting a woman during pregnancy?
No. So for that, I can give them the resources, and then I kind of point them to the OB-GYNs in the area that support, mostly in that. And we do have some excellent fertility doctors in the area that do phenomenal work that people see from all over the world. So I give them referral for that. But I do help them start in the process, and at that point I do mostly education. Because they really need that expert help. Sometimes, once again, as we talked about, it may not be PCOS, it may be endometriosis, uterine fibroids, or it could be dysfunctional ovaries themselves. You can even have what they call essentially your fallopian tubes can get obstructed with the mucosa or some other growth, so they may need a surgical process to that. So it can get quite complicated. So for that to give the best results, I kind of get my patients to where they need to be.
Okay. So for someone who may not know that they have PCOS, what kind of symptoms, other than weight loss, weight gain, other than that, what should they specifically think about seeing you and being like, I might have PCOS, and then be like, I need to see him and have you diagnose me if this is the case? Yeah,
so the biggest one is going to be irregular periods. So if you have very, very regular periods, that's a good sign. If you have very irregular periods since you were a kid, since you hit puberty, they're all over the place, then that's one of the signs you have PCOS. The other one would be like abnormal facial growth, like more hair on lips and chin, not just what we all not naturally have, both men and women, but you're like, hey, I need to keep shaving like every 2 days or every 3 days. It's not normal. My friends aren't doing this. So that's usually another big sign. The other ones also, you look in the mirror, you feel like I have very, very broad shoulders, which doesn't seem natural, or built more like a boxy look. May not be overweight, but more of a boxy look. That's a big one. Another really big one is horrible menstruation. Like most women, of course, is not the most pleasant experience when you're having a period. But for some women, it knocks them down to the ground. Like they can't get up, they can't walk, like they can't, even with the medications, they have an absolutely horrible time. That's also another big clue that you may have PCOS.
Okay, thanks for reiterating those. We do also want to talk about how hormone replacement therapy could potentially help in a cancer journey. So tell us more about that. Yeah,
so cancer, it's in itself, it's very complex. But the biggest one I really work with is prevention of cancer. We can kind of touch base about some of the other specific cancers as well. So with all the new measures coming out that shows as we get older, we tend to get more cancer cells. One of them is because of sun radiation. Your body is breaking down, as I like to put it. It puts you at higher risk for cancer. The other one they also notice is because when your hormone levels goes down, your immune system that naturally fights cancer, because your immune system actually finds cancer cells and kills them. Otherwise, we'd all be getting cancers in basically as soon as we're born. So your immune system become natural T cells, kill your cancer cells. So when we optimize hormones, we always notice that, hey, people are much healthier and they put them at much lower risk for cancer. The other one is also endometrial cancer and breast cancer for women. There's I don't know if this is like a real causation, but it's more for correlation that there's a reason why women have more breast cancer once they hit menopause. That's why we do the yearly screenings. Once there's a lot of studies that says when we start them on hormone replacement with both estrogen and progesterone, that actually prevents cancer from occurring or keeps it at the bay. So there's actually quite a few studies coming out that really support that aspect, that cancer prevention is the big one. There are also some, then it's kind of getting into little weeds, is, for example, some prostate cancers will get worse with testosterone, but the treatment is actually testosterone. So it really depends on what kind of receptors you have. That's why I recommend seeing an oncologist that specializes in this particular cancer, or seeing an oncologist that has more of a holistic approach. And if someone's in that period, hey, that they don't know where to go, ask them to reach out to me, then I'll be happy to point them in the right directions with my contacts, seeing who kind of works in that area.
So on that note, if prostate cancer, you said some men need more and some men need less.
Yeah.
What can you do for prevention then if you don't know which camp you fall in?
Yeah, so prostate cancer is kind of unique that every man will have a prostate cancer if they live long enough. So it just happens. It's the way your prostate multiplies and functions. Most men will have prostate enlargement, and with that, there's a risk for cancer. Most men will die with prostate cancer as well, like I said, not die from it. So if you do autopsy on elderly patients like 80 plus years of age, pretty much all of them have prostate cancer. But it doesn't cause any issues because it's such a slowly multiplying cancer that they don't do treatment for it, because the treatment itself is more caustic than you naturally passing away. But on some prostate cancer are very aggressive. Those can be deadly and they can kill you within a couple of years. So they're very aggressive and do treatment for that. So it really gets to nitty-gritty on, one, what type of prostate cancer do you have? It also depends on how old you are and what the expected lifespan is and what the expected treatment, because treatment itself is not the easiest thing for for oncological treatment. So all this goes into consideration to make a decision. But the reality is most men pretty much will have prostate cancer in their life. You just don't know about it because it doesn't cause any problems, and we just leave it be.
Okay. Well, I love how you're talking about bioidentical hormone replacement. And again, that word bioidentical is key. We talked about that in the last episode number 2, but how it's important for the prevention of cancer. But then what about if someone actively has cancer? You touched on prostate, but what about the others? Like, well, first of all, does this only apply to reproductive cancers, or if somebody has pancreatic cancer or something else, could hormone replacement therapy help benefit them?
So right now, most of the studies are coming out in reproductive cancer, because that's where I have the biggest receptor cells for hormones in general. But every organ has a hormone receptor. So right now, I can't comment one way or another, because there's not much interest in that area to study. So I haven't seen any concrete evidence one way or another. And even with the cancers in general, so some cancers, it can actually make it worse depending on what type of receptors they have. So let's talk about breast cancer. That's the most common cancer women experience. There's really big awareness. Right now, the success rate for if you catch breast cancer early is pretty much coming close to like 90% to 99%. Like it's phenomenal if you catch it early enough. We know a lot about it, how to cure it. But that also is a conversation we got to have with the oncologist, is because depending on what type of breast cancer, they each have different receptors for hormones, and it can actually make things worse. So that's why it's a conversation that we have to have with you, oncologist, and me involved in saying, hey, this is what we're dealing with. But at the end of the day, I usually defer to the oncological team because they are the experts in cancer, and especially for preventative cancer that's curable very easily. If you ignore it, I do see people in my ER that die from breast cancer, and a lot of times it's kind of heartbreaking because if they addressed it early in their life, they be completely cured and they have amazing quality of life. But if they don't address it, then it leads to early death. And kind of jump off that as well. Some cancer, breast cancer, they actually block your hormones completely. They actually give you a hormone blocker to shrink the tumor and cure it. But once you're cured, it's still this gray area. Hey, are you safe to start hormone replacement after that? And really, no, there's no concrete evidence. Unfortunately, it's a very gray area, and that's why you need the conversation with oncology to really get them involved.
So do you enjoy working with people primarily on the proactive wellness side pre having any sort of cancer, or do you also walk alongside people? Do you enjoy walking alongside people who have currently cancer or are in remission?
So I work with everybody because it gives you like a different I'm a little bit more selfish right now, but it gives you a different challenge in life professionally. So with people who have severe comorbidities and have oncological issues, then I love it first gets me educated on what's going on with them. And then most of the time it's me guiding them in the direction that they may want to go or giving them the resources they need. And it's always good. It's always self-satisfying for them to get some satisfaction on, hey, now I know what the next step is. I'm not just stuck in the world by myself, spinning my wheels. And I love working prevention because now they feel fantastic and they come back to me and then all they talk about is like how good they feel, which is, once again, makes you feel good too because you were able to help somebody else. So I don't turn any patients away. I'm always open for free consults. As I said, I just kind of sit and talk. And a lot of times I'm the right physician for them. Sometimes I don't have the expertise and I point them the right direction and say, look, I don't have expertise in this. But when we get either I have a connection or when we get your oncologist or OB-GYN or whatever you're dealing with involved in this conversation as well and see how things go.
So if somebody is listening to this, they have PCOS or maybe symptoms that point toward it, or they know someone who does, or they know someone who has cancer currently. You mentioned having a free consult with you. So how do they contact you?
And the easiest thing is to go on my website, Revamp HRT, REVAMPHRT.com, make an appointment. There's a link that says make appointment and it'll list literally all my free times. I think you just pick one that says initial consultation, either for hormone replacement or weight loss. It really doesn't matter. And then we'll sit down and see what's going on.
Awesome. We have spent 3 awesome episodes talking about hormones, and in your 4th episode, we're going to be talking about your other expertise, which is weight loss. So both medical weight loss, natural weight loss, you help people with both sides of that. So listeners, you guys can stay tuned for the 4th episode with Dr. K, and we will be back soon. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.